Dr. Leslie Robison considers himself a very lucky man. Lucky to have the mentors he's had, lucky to have the chance to see the impact of his work on the lives of pediatric cancer survivors, and lucky to be married to Mary. He is father of 2 beautiful daughters and grandfather to 5 fabulous grandchildren, the twinkle in his eye. It's there when he talks about his work, too, and to hear him describe his journey, you'd think he almost sees it as a fluke. There's a lot of serendipity, a lot of really good luck in my career, he says. For starters, it was the simple act of looking for a little pocket money while he was an undergrad at UCLA that lined Leslie up with his destiny. It's one of those things you just do, he explains offhand, applying for jobs as a student, get a little extra income, that sort of thing. He happened upon a job as a data manager at the USC Medical School Data and Statistics Center. My job was for the Children's Cancer Study Group, he explains. I was responsible for looking at data coming in from a national trial of childhood lymphocytic leukemia. The job lasted 2 years. His interest in epidemiology and cancer would last a lifetime. I was fortunate enough to be part of something like that at a very early stage. It just became very evident to me this is what I like. This is what I want to do. When Leslie graduated from UCLA with a degree in public health, Dr. Mark Nesbitt, chair of the study out of the University of Minnesota, made the offer of a research assistantship, and Leslie had a mentor, one who would guide him to and through some of the most important work of his life. He received his master's with a focus on survivorship among pediatric leukemia patients, and along came Mary. Well, they had actually met at UCLA, but upon completing his master's, Leslie realized she was a priority and returned to California long enough for them to end their long-distance relationship and tie the knot. An American Cancer Society Institutional Research Grant Award would take them back to Minnesota and allow Leslie to concentrate on the long-term implications of treatment on those same patients he'd been studying from the start. What emerged was the start of utilizing larger numbers of patients to inform what a risk profile for an individual patient might be, a precursor for Leslie's paradigm-shifting contribution to the field. It just struck me. Here we have all of these childhood cancer survivors where we know exactly what they were exposed to. We know what drugs, we know the mechanism of the action of the drugs, we know how much radiation. With that thought, the multi-institutional childhood cancer survivor study was born, but would take a monumental effort to pull off. They began initial discussions in 1987, and it took until 1994 to get the grant funded, he says. I had a lot more hair before the process started than I did when it was over. He can laugh about it now, well aware that it was all worth it. Absolutely. The impact we've had has just been tremendous, he says. And it has. The study's transformative influence on clinical guidelines for cancer treatment and follow-up is sweeping and ongoing. The study provides an evidence base for patients to be screened for outcomes, so clinicians can provide a level of care that reduces or removes treatment exposures, and has for nearly a quarter century. The reward of the effort is not lost on Leslie. We're seeing our research translate into patient care, and that's really gratifying, he says. You can actually see the impact of your work really changing lives and outcomes. In his 11th year as chair of the Epidemiology and Cancer Control Department at St. Jude Children's Research Hospital, Leslie Robison is still changing lives. He credits collaborators like close colleague Melissa Hudson, who's involved with both the St. Jude cohort and CCSS, for taking the findings and distributing them globally. Leading-edge information is updated online constantly for the oncology community, specialists, family practice physicians, and survivors themselves to really understand what level of care they should be engaged in to minimize the impact of treatment. My hope is that we'll be able to say to a child completing therapy for cancer, you can now live a life that's exactly the same life you would have lived if you hadn't gone through this experience. That's the hope, he says. Robison credits the American Cancer Society for being one of those serendipitous partners invested in that hope from the beginning. Yes, I worked extremely hard, he says, but without the specific people I connected with along the way, I have no clue where I would actually be right now. I was incredibly lucky, and doubly lucky to be going home to Mary. This evening, we count ourselves fortunate to honor Leslie L. Robison for his outstanding contribution to the advancement of cancer treatment, prevention, and screening, and the difference it has made in the lives of countless cancer survivors.